So the clinical signs that we see, which, it takes 2 to 3 days for you to actually see clinical signs from when the gum disease obviously starts. So you see things like bleeding. Bleeding's a big one. So healthy gums don't bleed. So when you brush, if you're seeing blood, that's an indicator to know your gums are unhealthy. When you floss, you can also have like puffiness with your gums, tenderness. That's all the signs of inflammation, which obviously means disease. Also, you can have loose teeth, draining sinuses, so draining little pimples that drain, that's an abscess. Bad breath is another one, that's a stimulation from the bacteria. So there's all those sort of things that you'd look out for, but obviously you need to go and see a dentist to have it all confirmed. Well, like I said before, the first thing is we educate them on the gum disease, because as much as I can clean their teeth for them and get them to a level, it's not going to change unless their home care changes. So the first thing we do is we educate them on home care. We get them to swap over to our sonic brushes and teach them how to brush correctly with that. From there, we then do deep cleaning, which is mostly done under local anaesthetic. So I'll go down and clean all the root surfaces of the teeth to get rid of any plaque and calculus that's in there. Then some people may need a little bit of further treatment where I'll then laser the gums down below the gums and the root surfaces as well. So that's the main initial treatment. They then come back in 6 weeks and we then do a charting to see how the gums have responded, and we also do review their oral hygiene to make sure that their home care is up to where it needs to be. So gum disease is something that can go into remission, which is what we're trying to achieve, so we don't have further damage with bone loss and so on. But if it's not maintained at the level that it's required, the gum disease can reactivate and you can then go on for the disease to progress further. So it's important that you keep up with your regular maintenance plans, which can be anywhere from 3 to 6 to 12 monthly cleans, and that depending on what your tailored plan is. And if you have any further questions, we've got a patient education section on our website that you can go through, and it has frequently asked questions and answers that you can also read through.